basically learning that there was more to his condition with these co-infections than just the standard diagnosis you get from an MD.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, a doctorate in OT, specializing in neurology, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, registered herbalist with the American Herbalist Guild, and author. Her naturopathic journey began when her son, who was diagnosed with autism, developed a series of traumatic, life-threatening chronic health issues. For over a decade, she's honed her skills to combine the ancient Ayurvedic healing practices with Western herbal medicine that has helped patients in over 50 countries and recovered her son, who is on his own journey towards becoming a physician. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Welcome back to Autism Uprooted. Today, it is my great pleasure to welcome an amazing mother from Canada who has most kindly agreed to join us here today to talk about her journey, her ups and downs, and the amazing results that she is seeing with an all-natural plant-based medicine herbal protocol for her son diagnosed with autism spectrum disorder. It's wonderful to have you here with us. Welcome.
It's a pleasure to be talking to you today.
Many people out there don't understand that sometimes children on the spectrum can have medical conditions underlying, and sometimes the beautiful biomedical protocols that have been developed early on that may not work as well, or that may be a little bit outdated as well. So would you be able to tell us what made you decide to try plant-based protocol? What had you done before, and what brought you to the herbal protocol?
Started off with just the mainstream therapies, behavioral therapies, and we saw that that wasn't really getting us anywhere. There was just a lot of frustration there. So then we went into naturopathic medicine, homeopathy, and there was a lot of very good advice. And we started to see from a child who was very agitated, who was not responding well, who was just very poor self-regulation, poor sleep habits, just a child that just seemed he was just uncomfortable and almost in pain being in his own body. With all their advice and with their protocol, we did start to see some improvement. So we kept on with that. From there, we branched off into biomedical, because as a parent, when you have a child with these particular needs, you're always trying to look for something else, something better to improve the situation for their health and whole well-being of the family. So we started with the biomedical, and again, we went, I'd say, a level further, a notch higher. And again, we had improved results with, his stools, his bowels. Again, sleep got marginally better, and we just kept continuing with the progress. But then after another couple of years there, we felt like we hit another plateau and nothing was really happening. So we were following all the food sensitivity guides and, eliminating the gluten and the dairy and all the supplements and everything that was advised to us. But we just kind of felt like we hit a wall. He had just kind of stayed still for the longest time. And so, of course, I kept looking further. And when I saw you online, when I saw BioNexus, I was very, I'd say, intrigued by that, because it was a different avenue, a different approach that had never been addressed to us before. The fact that there could be other things involved, like co-infections, mold issues with PANS or PANDAS, it just made me realize, well, there's still something more we can do. And because the approach is all natural, you're using herbal products, it's not, you're not running the risk of side effects with drugs or heavy medications, especially on a young child. And they're organic herbals too. I thought, this is something that I'm definitely going to look into, which is what we did. And we started, and I knew things were changing for the better when I started getting reports from school, from the teachers, saying that, he's more willing to try new things. He has more self-regulation. He just seems like a happier child. And we could see that at home. It was like he just suddenly, there was much better eye contact, much better interaction. He wanted to play. He wanted to laugh. He wanted to be tickled. He wanted to enjoy things, not just stay away from everyone and just not be touched and not be bothered. And it continued again. The toileting got better and better, and we were able to progress to no more pull-ups. And that was something that at school they said, how did you do it? Because they couldn't figure it out themselves with their routine of, bringing him every 20 minutes, and it was hit and miss all the time. And I think he just felt it within his own body, the urge when he had to go, and he was able to regulate it that way. And the sleep, I mean, we were getting 7-8 hours straight, which before was not possible. He would wake up happy, and he still does wake up happy. I was used to him waking up and just kind of, okay, now what? And he would wake up screaming and crying in the past, oftentimes, not every day, but now he's a different child in the sense that he's happy the way a young child should be. And he wants to get out there, and he wants to play, and he wants to explore. He's doing little things that children would normally do. So we've noticed a lot of that, his alertness, and even just cognition, understanding, following instructions. So there's been an overall shift and improvement. And every time we meet with you, every few months when we do our review, there's always something you modify, you add, you change. So we work with where he is, I guess, and then we up it a little bit and tweak things up, and we just try to keep getting better and better. And this is definitely something that I'm very grateful to have found, because otherwise we would have still been probably stuck where we were a couple of years back.
It's important for people to understand that it's a process.
Yes.
It's not a few months. It's not, not a few weeks, certainly not a few months. It's usually takes a couple of years to achieve that optimal results that most mothers look for, all mothers look for, when you have a child on the spectrum.
If you want to just remedy it quickly with a medication, he's acting up, give him this drug. That's a different approach as far as I'm concerned. I don't think you really address the root cause of the problem when you go back and you talk to us, excuse me, about the co-infections, about the PANS, the PANDAS. These were things that had never been brought to our attention. And if this is what is agitating or aggravating his system, and we can heal it, then I think that is the best approach, in my opinion.
I would agree with that opinion, Alice. So, because, it took me about 7.5 years on my journey with Brian to figure this out step by step by step, till where now most patients, most parents, when they meet with me, and that 7.5 years of knowledge is handed out in the first appointment, that, hey, you know what? These are the things we need to look at. And it's if there are underlying medical issues, and if those are appropriately treated, then obviously you will see improvements. You may not see anything quick, the behaviors may not go away right away, but if you stick with it, and we are slowly, able to get rid of the infections, the mold toxins, the other environmental toxins, you will definitely see an improvement.
Yes, you have to be committed. That's for sure. Again, it's not a quick fix, but I think in the long term, it's the best way to receive, permanent gains. I've seen that the areas that he's improved on have stayed at that level and gotten better. It hasn't been improvement for a week and then he's regressed again. It's a slow and steady incline for us. That's our experience.
Okay. I'm going to take something that you said and expand on that. That is very interesting. And I see that over and over again with patients that, when improvements happen on an herbal protocol, those improvements will stick with the child. There's no back and forth. There's no regression. Sometimes there is that die-off reaction in a Herxheimer reaction, but that is very temporary. And then usually the improvements, they stick, and you don't see this back and forth that is sometimes seen with biomedical approach. I had the same experience with the biomedical approach as well. Initial, we saw good gains and then plateau.
I mean, you do the best you can, and we want our kids to achieve the best that they can in a way that's non-invasive. I would never risk giving my child something that could have these severe side effects. I would be too afraid to do something like that. I'm very cautious. Before I try something, I really look at it and I read about it and I try to find out everything. And I felt very comfortable with this and with you from the beginning, because you're very wonderful and you're very kind and you're very warm, and you really helped us a lot, and you are continuing to help us. I feel very comfortable speaking to you.
Thank you. Thank you. It's been a privilege, having you on board BioNexus and seeing the improvements that Angelo has made. It's been wonderful to see that. It makes my day, when I hear children that have made such great strides with their autism spectrum diagnosis, and before you know it, he may not qualify as autistic anymore. I know we have ways to go, but little by little, I think that should be our goal overall.
Well, definitely that would be wonderful. And when what really got me was when I was listening to you speak about your experience with your son. Mm-hmm. And if you had just followed what you were being told by mainstream medicine, I don't think your son would be the point where he is today. And just hearing, how you unraveled all of that and everything you've built around it and the progress that he's made, that's what really affected me. And I thought, this is somebody who's been through it. She's felt it. She's a mother who wants to help her child. And for us, it was just the right path to take.
I have an interesting question for you. How did you manage to, because BioNexus protocol is a step-by-step approach. It's not easy. It can get complicated in the beginning, a lot of information. So how did you manage to give all of the herbals to Angelo? How did you manage with all of the supplements, the capsules, the scheduling? How did you do it?
I asked you to give me an example of what the parents are doing. And I kind of thought, okay, how can I apply that? Because my child has his own sensitivities. He's not going to just welcome all these different tasting herbs. And I thought he's not going to do this. But I started with the drops in the water, and I started very slowly, very gradually, like you say, a couple of drops, 1, 2, and I saw, okay, I gave it to him and I still do, in a fancy glass. So it's like a special drink for him. So I give it to him, I present him with this special drink, and he drank it the first time and he liked it and there was no problem. So I continued adding the drops, and I tasted it myself, and I thought, you know what, this is very doable. And for us, really, he looks forward to it. Maybe it's the presentation that I give it to him in, but he takes them 3 times a day. In the morning, when he gets home from school, this was pre-pandemic. Now it's, 3 and 3, 4 in the afternoon, and then bedtime. He looks forward to it. He doesn't give us a problem. He just grabs it, he drinks it, and we're fine. I mean, and there's other things that he takes. There's certain things, certain vitamins. I do fruit smoothie for him, and I'll put certain vitamins in there with his fish oil and other stronger tasting things. I'll mix them in. I do a soup with sweet potato and other vegetables, and I blend everything together, and he eats that. So really, in terms of taking the supplements, he doesn't give us any trouble. And the Epsom salt baths that you suggest, he loves that. I can't take him out of the bath, how much he enjoys that. And really, it's just been gradual. Every time we start a new supplement, like you say, to avoid the Herxheimer effect, and we really haven't experienced that. I'll be honest with you. Maybe I just gradually increase. I follow your steps, and we haven't had any bad reactions, not even once.
Let's talk about the nasal spray for mold-associated MARCON, sinus infection. I have two questions about that. How do you manage with the nasal spray for Angelo? And also, if I believe your other son had allergies, which got better with the nasal spray. So if you wouldn't mind kind of, elaborating a little bit on that as well.
For years, we didn't understand this stuffiness we all had, a bit of like a runny nose, dry cough, on and off. And then when you had us check our home for mold, I was shocked to find that there was mold, and it's coming from the basement, from the cellar where there's water. And again, that's something else that nobody had ever explained to us. And so we started with the nasal spray, and it's, for us, I use it myself as well, and spray the kids' noses. It's changed the allergy situation tremendously. A lot of times I would think my son was coming down with a cold, and I realized that it wasn't a cold. It was this allergy to this mold that we never knew about. Now we've cleaned it out, and we've made the living environment much better. I mean, for this, again, this is from the cellar. Nobody really stays in the basement, but I guess it was affecting us upstairs. But as soon as we use the spray, for myself, it just clears up the nasal passages. And with my kids too, we don't have that consistent kind of stuffiness, that dry cough. My older son, he's always been prone to seasonal allergies. And ever since we started using the nasal spray, he hasn't needed to take any over-the-counter medication for that either. So that's been wonderful for us. And that's again another area that you brought to our attention that was never brought to our attention before. I mean, no one ever suggested that.
That is something that really benefited my family as well, that understanding that environmental toxins can affect the health of everyone. You may have your child who is affected the most because of other immune system related issues and co-infections, but it can affect other members of the family as well. And along the journey of recovering one child, I myself and other families too see that other members of the family seem to get better as well.
I mean, my younger son is the one that is more effective. He does have, most of the issues, and he was the one that you could see the biggest changes in, obviously, especially even like we were talking about the mold. I forgot to mention too, the redness in the eyes, always rubbing the eyes. All of these symptoms were improved with the spray.
He's progressing really well. He's coming along really well academically, at home, right? Behaviorally, sleep. Can you talk a little bit about his gut and diet?
We've had him on gluten-free, dairy-free for years now. Overall, I mean, he used to have a lot of like stomach discomfort. We could tell because he would be holding his stomach. He had trouble. He was always constipated. It was either it was like irritable bowel, back and forth all the time, very irregular. Now, with his diet, it's basically mostly organic, as much as we can get. Can't always be 100%, but it's mostly organic. And with all the supplements that he takes, he's shifted completely in terms of the stomach discomfort. We don't see him, holding his stomach anymore. He's going to the washroom regularly. And it's just, I believe, I know that the gut and the brain are connected, that has had a lot of influence on his brain function too, in terms of cognition, understanding, and just overall like self-regulation. in general. I think it's all connected, like you've said before. So we've noticed a big difference with that, the non-gluten, non-dairy, and now, starting slowly with the camel's milk, like you had suggested.
Yes. So you have started camel milk with him.
Just started now, so
Okay.
I don't have that much to report on yet, but I'm sure we will start soon.
That's another podcast that I'll be doing as well. Many have asked me to share the slow buildup and therapeutic use of camel milk in children with autism spectrum disorders. And so I'm glad that you have been able, because I know there was like a little bit of challenge getting the camel milk, but now that's all settled.
Overall protocol, I mean, I can't pinpoint and just say, well, it was just, it's everything. It's the diet, it's the herbal supplements, everything all together. Even just his attention span has gone from 5 minutes to we can get him to sit for 40 minutes straight and do schoolwork and then take a break. In the past, that was something that was just not possible, and now it is. And he's getting better and better. And he's able to stay focused longer and longer. And that's a huge milestone for him.
Academically, with focus and performance, he's improving as well with
Yes.
his studies.
Yes, he's understanding a lot more, and he's more interested. He's more curious. He wants to learn. Whereas before, it was just like, hurry up and get this done. I want to go. Now he's interested. He's looking in the books, and he's looking at the activities that we're doing. And many times he'll bring me to the table, or he'll take out activities, because now, of course, we're doing the homeschooling still because of the pandemic. So
Yes.
he'll bring me to the work table, and he wants to do his work. And in the past, it was just not like that.
So my last question for you would be to kind of sum it up for all of us, and especially those watching. What would you say was Angelo's situation before starting the plant-based herbal protocol, and after?
It was frustrating and discouraging, because again, like I said, when we kind of just hit the plateau, we started thinking, is that all he's going to achieve? Is it going to be a constant battle? And so it was disappointing and frightening, because as a parent, of course, you worry for your child. You always think, what's going to happen in the future? But now, I mean, I've realized that there is another way. I mean, it's never really the end if you keep yourself open to new possibilities. And your program for us was another way. It was basically learning that there was more to his condition with these co-infections than just the standard diagnosis you get from an MD. And that for us changed everything, because when there's hope, then you have that drive, that inspiration to do more. And when you see more happening, it's endless, and the possibilities are endless. And now there is definitely a different outlook on his future. And I know that he feels better about himself, because every time he accomplishes a new task, I can tell he's proud of himself, and he's developing more confidence in himself around other people. And any parent, to feel that is just beyond words. I can't even find the words to express how grateful I am to you, to this program, and just for the opportunity to having found it and applying it every day. I'm just looking forward to him now going back to school once the schools are open up again, because I know that the teachers are going to tell me that, again, that he's made a big jump forward, and we see him changing all the time. And they're good changes. They're the simple, happy pleasures that any parent wants to see their child experience and enjoy.
You put that so eloquently. Well, let me take this opportunity to thank you from the bottom of my heart for being here today to so generously share your story. And I know it is going to be helpful to so many people, so many mothers and fathers and caregivers around the world watching.
Well, I would suggest that to any parent or any caregiver who, either just is frustrated with what they're doing or wants to improve what they're doing, that there is another way. And because it is a safe program, I would really strongly recommend that you take a look at this program and then you be the judge. I can't thank you enough and everything you've done, and I look forward to working with you ongoing.
I feel the same, Alice. It's been, I don't know, it's been absolutely wonderful to work with you, Angelo, your family. And I think you were my first family from your area in Canada that we started working with. And I think, we are kind of building a little bit of a network in that area as well, with couple MDs and DOs who are slowly understanding and coming on board, helping us take care of our children a little bit better. So I'm glad that you have contributed to that as well. So it's just, warrior mom through and through. Thank you again for being here today.
I can't thank you enough, Dr. Dashore.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.